What a great start. Thank you so much. It's now my pleasure to introduce my longtime friend and colleague, Susan Skochelak, who will facilitate the next portion of our meeting this morning. This will be the first session in our section on envisioning the future of curriculum design and structure, looking now in particular at models of partnerships in and out of academia. So, Dr. Skochelak.
Good morning. Thank you, Chris Olson. And could I invite my fellow panelists to come up and join while I introduce this session and while I introduce them. Thank you, Institute of Medicine and Global Health Forum, for the opportunity for this section in envisioning the healthcare education for our future workforce. To forecast for you what we'll do for the rest of the morning, I'd like to refer you to the agenda so that you understand that this session's title is Envisioning the Future of Curriculum Design and Structure. And in order for us to make the meaningful changes that Susan Scrimshaw put before us this morning, and that we also just heard from Secretary Campos, we have to break some boxes. We can't keep reforming within the current curricular structure, no matter whether it's a 4-year, 3-year, 2-year, or you define in your own professions those lines, guides, scaffolding, and boxes that are limiting us now, currently, from only allowing for reform and tinkering of curriculum around the edges. We put together a panel of 4 speakers today that are going deeply into facing the challenges that we've talked about in this forum over the last couple of years. I want to let you know that all 4 of these speakers are in programs that are addressing interprofessional health education, but that won't be their topic today. They're talking about areas that relate to the structure and the design. So if you have questions about IPE, ask them over the lunch hour. The fact that they're not talking about it doesn't mean it's not existing in all the programs. But we're focusing, for example, with Dr. Art Kaufman, who serves as Distinguished Professor and Vice Chancellor for Community Health at the University of New Mexico Health Sciences Center, about working with communities and changing the healthcare team so that we can address the social determinants of health. We'll talk with David Asprey, who is the Assistant Dean of Student Affairs and Curriculum and the chair of the Department of Physician Assistant Studies and Services at the Carver College, University of Iowa, on models for educational efficiencies to allow us to do more with sometimes shrinking resources. We'll talk with Elizabeth Baxley, who serves as the Senior Associate Dean for Academic Affairs at the Brody School of Medicine at East Carolina University, about new models that they're using for faculty development and training in the competencies that we know we need, that we as faculty have not yet learned to impart to our students. So we'll take a break after that. We'll bring up a final panelist, and then my colleague Timmy Barwick will use the discussion time to formulate some challenges to all of us to engage in deep discussion before lunch. That's the format for the session. I also might mention to you that 2 of the 4 panelists today are here from a group of schools that I've had the privilege of working with in my role at the American Medical Association through our Accelerating Change in Medical Education initiative. 11 schools are doing deep work, and if you'd like to hear more about them and learn more, we have a website at changemeded.org. So I'm happy to talk later about that initiative, but very proud to showcase at least a few of the schools that are really trying to break that box of the curriculum. With that as a most brief introduction, let's start with Dr. Kaufman. Please come forward. I think it'll help with the webcasting if you stand at the podium.